Some beliefs have life and death consequences, and one of the most misunderstood is that one of Jehovah's Witnesses and blood transfusions. If you're not familiar, Jehovah's Witnesses are taught that accepting whole blood transfusions is forbidden. So in a medical emergency, this belief can directly affect what treatment someone will accept. As someone who used to be a Jehovah's Witness, I can answer, why do they believe that? So the simple answer is Jehovah's Witnesses interpret several Bible passages as a command to abstain from blood. They connect blood with life, something sacred, and they believe that taking blood into the body, even medically, breaks that command. So it isn't actually framed as a preference, it's framed as a must. It's a question of obedience. And inside the religion, obedience is treated as a serious spiritual matter, especially under pressure. In practice, Jehovah's Witnesses generally refuse whole blood and the main blood components, which are red cells, white cells, platelets, and plasma. But there is an important nuance here that I want to mention, that some treatments involving blood fractions or smaller parts derived from blood or the main components are actually considered, may be considered as a matter of personal conscience. So individual witnesses can make certain different choices on certain products. Now, what is expected from the members? Many witnesses are encouraged to be prepared for emergencies by carrying a signed medical directive refusing blood. So it can be acted on quickly if, for example, they can't speak for themselves. And there's also a whole support structure around this. Jehovah's Witnesses have what is called a hospital liaison committee, and it's a network designed to help clinicians and patients plan treatment without transfusions, share medical information, and to coordinate support. Now, from the outside, that looks very organised, and it is organised, but here's the part that matters on emotional level, and that hard part is the pressure. And inside this culture, refusal isn't usually presented as a neutral medical decision. It's often framed as a loyalty issue, a test of faith, especially when the stakes are high. So in real life, we know the emergencies are not calm. There can be accidents, sudden surgery, childbirth complications, and those decisions they can be fast, stressful, emotional. And when someone has been taught that obedience equals safety, their nervous system can go straight into fear, guilt, and urgency, even while doctors are simply trying to save a life. And this is another reason why ex-members, such as myself, talk about these things. This is not to attack individuals, because most people inside are doing what they genuinely believe is right. I mean, I used to believe it. But because doctrines like this don't stay theoretical, they show up in hospital rooms, and belief can affect care. And that's why speaking up matters. And that's why I continue to speak out, because we will not be silenced anymore.